There is something quietly happening inside millions of people right now. A slow, silent shift that most of them will never feel until it's already gone too far. And I don't say that to frighten you. I say it because I've seen it, over and over, in exam rooms and hospital wards. People who looked perfectly healthy, felt mostly fine, and had no idea that their kidneys had been struggling for years. Well, I'm Dr. Naira Stein, a senior health and wellness consultant, and if you've ever wondered whether your body might be trying to tell you something you've been too busy or too uncertain to listen to, then I want you to stay with me today, because what I'm about to share with you could genuinely change the course of your health. Stick with us. We're here to help you understand your body with the warmth, clarity, and honesty you deserve. Now, here's what I find most remarkable about the kidneys. These two small bean-shaped organs, quietly tucked beneath your lower ribs, one on each side of your spine, do far more than most people ever give them credit for. Yes, they filter waste from your blood and pass it out through your urine, but that's only the beginning of the story. They manage the delicate balance of salt, potassium, and other minerals your body depends on. They regulate the acid levels in your blood. They produce hormones that control your red blood cell count. They even play a role in keeping your bones strong. In every quiet moment of your day, your kidneys are working, adjusting, correcting, maintaining. And here is the sobering truth. Up to 9 out of 10 people living with chronic kidney disease right now have no idea. No idea at all. That's not a small number. That's the vast majority. And the reason is deceptively simple. The kidneys almost never cause pain when they're struggling. They don't announce themselves. They simply begin to fail, slowly, while the person goes about their life. That's precisely why learning to read the early signals your body sends can be the difference between catching a problem while it's still treatable and discovering it far too late. So let's begin. Let's walk through the signs together, some subtle, some surprising, and I promise to explain not just what they are, but why they happen, so this knowledge actually stays with you. The first thing I want you to think about is something you probably never pay much attention to: the appearance of your urine. We all check it briefly, perhaps register the color, and move on. But if you've ever noticed a persistent thick layer of foam sitting on the surface of the water in the toilet bowl, not a few disappearing bubbles, but a dense, white, staying foam, the kind you might see on a freshly poured drink, that is your body sending you a message. Inside each of your kidneys lives roughly 1 million microscopic filtering units called glomeruli. Think of them as extraordinarily fine sieves made of tiny, tightly woven blood vessels. Under normal conditions, these filters allow water, minerals, and waste to pass through into the urine, while holding back the larger molecules, most importantly, a protein called albumin. But when those filters become damaged or inflamed, gaps develop. Albumin begins to slip through. And albumin, it turns out, behaves a great deal like soap. It creates foam. Persistent foam in your urine, then, is often the visual trace of protein leaking from your blood, a quiet alarm bell from filters that are no longer holding the line. Now, here's something I'd like you to try. Roll up your trouser leg and press your thumb firmly into your lower shin, right against the bone, and hold it there for about 5 seconds. When you release, look carefully. Did the skin spring back immediately, or did it leave a small dent behind? If you see an indentation, that's called pitting edema, and it connects directly to what we just discussed about protein loss. Here's why. Albumin in the bloodstream does more than just circulate. It plays a critical role in keeping fluid where it belongs, inside the blood vessels. It does this through a process called osmosis, essentially drawing water toward itself. When albumin leaks into the urine and blood levels fall, that pulling force weakens. Fluid begins to seep out of the vessels and into the surrounding tissues. Because gravity pulls it downward, the legs and feet are usually the first to swell. Sometimes the loose tissue around the eyes is affected too, particularly noticeable in the morning. Here's the cruel irony of it. Despite being swollen, visibly holding extra fluid, your body actually has less circulating blood volume than it should. And your kidneys, sensing what they interpret as dehydration, respond by holding on to more salt and water, which makes the swelling worse. It becomes a self-reinforcing cycle. In more severe cases, fluid can even accumulate in the lungs, making breathing harder than it should be. I want to be careful here. Leg swelling has many causes, and mild puffiness after a long day on your feet can be entirely normal. But if your swelling doesn't ease overnight, if it's spreading toward your face, if it keeps returning, please don't dismiss it. There's a common misconception I hear regularly that I'd like to gently correct. Many people believe that urinating frequently is a sign of healthy, well-functioning kidneys, proof that the filters are doing their job. But that's not quite right. In fact, one of the earliest and most telling signs of kidney trouble is changes in your urination pattern at night. Healthy kidneys have the ability to concentrate urine when you're sleeping, producing less of it but making it more potent. This is partly thanks to a hormone called ADH, or antidiuretic hormone, which the brain releases as you drift off to sleep. But when the kidneys begin to lose function, this concentrating ability is often among the first things to go. The kidneys begin producing larger volumes of more dilute urine even through the night. If you find yourself waking 2, 3, or more times before morning, not because of stress or a late cup of tea, but simply because your bladder won't let you rest, that pattern, which we call nocturia, deserves attention. Now I want you to glance at your fingernails. Not for a cosmetic inspection, but because your nails can carry information that your kidneys are sending outward. Normally, you might notice the pale crescent at the base of each nail, the lunula, the region where new nail is still forming. That's perfectly healthy. But in people living with chronic kidney disease, a different pattern sometimes appears. The nail takes on two distinct zones of color, the lower half appearing washed out or white, and the upper half turning a reddish brown. These are called half-and-half nails, and while not everyone with kidney disease develops them, and while we don't fully understand the exact mechanism behind them, their association with kidney dysfunction is well established in medical literature. Sometimes the most unexpected places on the body carry the clearest clues. Let's talk about a mineral called phosphate. Your body manages phosphate with great precision, absorbing it from food, using what it needs, and excreting the rest through the kidneys. Most of us actually consume more phosphate than our body ideally wants, but healthy kidneys handle the excess without complaint. When kidney function declines, however, that ability to excrete excess phosphate weakens. Levels in the blood begin to climb, and phosphate, when it builds up, causes trouble in a very particular way. It binds with calcium in the bloodstream, forming calcium phosphate crystals. Depending on where those crystals land, the consequences can range from uncomfortable to genuinely dangerous. When they deposit in the skin, small, hardened, pale yellowish bumps develop, a condition called calcinosis cutis. These lumps are usually painless and may even rupture, releasing a chalky, paste-like material. Unpleasant but manageable. Far more serious is when those same crystals accumulate inside the walls of blood vessels. The smooth muscle cells that normally line our arteries, flexible, responsive cells designed to constrict and relax with each heartbeat, begin to behave as though they've forgotten what they are. They start laying down calcium phosphate as if they were building bone. The artery wall, which should be supple and elastic, becomes rigid and hard. On an X-ray, you can actually see the arteries, which ordinarily would be invisible, rendered in sharp, bone-white detail. Felt beneath the skin, they have a taut, wiry quality, almost like a tightly strung cord. The body does try to counteract rising phosphate, It releases a hormone called FGF23, which signals the kidneys to expel more phosphate through the urine and tells the intestines to absorb less of it. Part of this process involves suppressing the conversion of vitamin D to its active form, which then leads to declining calcium levels in the blood. And when calcium falls, whether from this process or from the early changes of kidney disease, which can also lower magnesium and cause blood to become more acidic, the muscles begin to suffer. Cramps, often severe, often nocturnal, striking just as you're settling into sleep. If you're experiencing unexplained muscle cramps that aren't related to exercise, it's worth asking your doctor to check your kidney function and electrolytes. Low calcium also triggers the parathyroid glands, 4 tiny structures nestled near the throat, to release their hormone, PTH, which instructs the bones to release their calcium stores into the bloodstream. In the short term, this restores balance. Over months and years, it hollows the bones. The skeleton becomes porous and fragile. People lose height as the vertebrae compress. Fractures begin to happen from falls that shouldn't have been severe enough to break anything. This is the bone disease of chronic kidney illness. Quiet, cumulative, and preventable when caught in time. Beyond the mineral and electrolyte disruptions, there's another phenomenon that emerges as kidney function declines. Waste products that healthy kidneys would normally filter and eliminate begin to accumulate in the blood. The medical term is uremia, which, if you translate it directly, means urine in the blood. It's not a comfortable thought, and the experience of it is equally uncomfortable. One of the earliest and most tormenting effects of uremia is an itch that has no visible cause and no satisfying remedy. Not a rash, not a bite, just a persistent, gnawing urge to scratch, usually worse at night, sometimes severe enough to break the skin. Uremic toxins accumulate in the tissues and activate specific itch receptors on the setter, nerves. Over time, with chronic exposure, the brain's own itch pathways become sensitized, leaving a person in a state of near constant irritation. For the 57-year-old man I think of often, it was this relentless itching that finally drove him to seek care. Blood work revealed advanced kidney disease. Uremia also disrupts sleep in another way, through restless leg syndrome, an overwhelming, irresistible urge to move the legs, typically worst when lying still. The leading explanation involves iron. Uremic toxins trigger chronic low-level inflammation, which causes the body to overproduce a hormone called hepcidin. Hepcidin's normal job is to starve bacteria during an infection by locking iron away in storage and blocking its absorption from food. But when hepcidin rises inappropriately, as it does in kidney disease, the brain's dopamine system becomes starved of iron even without any infection. And disrupted dopamine signaling in the brain is what generates that maddening, leg-moving compulsion. The senses are affected too. Imagine sitting down to a meal you've always loved and finding it tastes metallic, flat and wrong like old coins. This is a common experience in kidney disease. Urea that accumulates in the blood eventually finds its way into saliva. Bacteria in the mouth convert it into ammonia and related compounds, which land on the taste receptors of the tongue as something distinctly metallic. In some people, the breath itself takes on the faint, unsettling smell of urine, a condition physicians call uremic fever. It's no wonder that appetite begins to disappear. But it goes further than taste and smell. Uremic toxins can reach a region of the brain called the chemoreceptor trigger zone, a patch of neural tissue with no blood-brain barrier, specifically designed to detect toxins and trigger a vomiting response to expel them. When uremic toxins reach this zone, the brain treats them as a sign of poisoning. The result is nausea, loss of appetite, vomiting, and gradually, unintentional weight loss. Even the blood's ability to clot is impaired. Platelets, the tiny cells that rush to a wound and clump together to stop bleeding, become sluggish and less adhesive when bathed in uremic toxins. You might notice that your gums bleed more readily when you brush your teeth, that nosebleeds come more often than they used to, that bruises appear on your body and you genuinely cannot remember how they got there. Large, dark bruises from impacts that shouldn't have left a mark. In extreme, advanced cases of kidney failure, cases where treatment has been significantly delayed, the toxins become so concentrated that when a person sweats, the evaporating moisture leaves behind a fine, crystalline, white residue on the skin. It's called uremic frost, and it looks exactly as it sounds. It is rare, but its presence means the situation has become critical. There is also a complication that affects the heart. Uremic toxins can inflame the pericardium, the thin protective sac that wraps around the heart. When this membrane becomes inflamed, every heartbeat causes the heart to rub against irritated tissue. The pain is real and significant, and when a physician listens with a stethoscope, they hear not the clean rhythm of a healthy heart, but a coarse, leathery scratching, the sound of inflamed surfaces moving against each other with every beat. And through all of this, the sleep disruption, the itch, the cramping, the nausea, the toxin accumulation, there is one symptom that perhaps more patients mention to me than any other: fatigue. A bone-deep, relentless tiredness that rest doesn't fix. Part of it comes from everything we've discussed: the disrupted sleep, the metabolic chaos, the chronic inflammation. But there is one specific and under-recognized cause worth naming directly. The kidneys produce a hormone called erythropoietin, EPO, which signals the bone marrow to produce red blood cells. When kidney function falls, EPO production falls with it. Fewer red blood cells mean less oxygen delivered to every tissue in the body. The result is anemia, and not the mild, easily corrected anemia of iron deficiency, but a deeper, more persistent exhaustion. The kind that makes climbing a single flight of stairs feel like a genuine effort. The good news here is real. Synthetic EPO exists, and when given by injection, it can reverse much of the anemia caused by kidney disease and restore a meaningful measure of energy and vitality. And finally, and this is perhaps the most important point I will make today, there is one more sign of kidney disease I need to name: the absence of any sign at all. Chronic kidney disease is classified in 5 stages, from mild early dysfunction to the advanced failure that often requires dialysis. And the truth is, most people move through the first 2 or even 3 stages without feeling a single thing that prompts them to seek care. The disease is often discovered not because of symptoms, but because a blood test or urine test, ordered for another reason entirely, reveals something unexpected. This is why the most powerful tool in preserving your kidney health is not waiting to feel sick. It is regular monitoring. A simple blood test measuring creatinine levels, a urine test checking for protein, particularly if you carry risk factors for kidney disease. And the 2 biggest risk factors, far and above the rest, are high blood pressure and diabetes. Both are conditions we can identify early. Both are conditions we can treat. Both can be managed in ways that protect the kidneys for decades. There are other causes too, and one that I am seeing with increasing frequency is the quiet, chronic overuse of common anti-inflammatory medications. The ones you can buy without a prescription at any pharmacy. Ibuprofen, naproxen, taken occasionally for a headache or a sore back, they pose little risk. But taken regularly, week after week, they can cause real and lasting harm to the kidneys, as well as to the stomach and the cardiovascular system. If you rely on these medications consistently, Please speak with your physician about checking your kidney function and about finding alternatives. Your kidneys have been working quietly for you your entire life. They've never asked for much in return, but they are not invincible and they cannot speak for themselves. That responsibility falls to you and to the small, consistent choices you make to care for your body before it tells you it's in trouble. Pay attention to the foam. Notice the swelling. Listen when sleep becomes difficult. Look at your nails. And most of all, don't wait for pain to be your signal. For your kidneys, there often won't be any pain. There will only be these quieter messages, the ones we talked about today. I hope this conversation gave you something valuable. Not fear, but understanding. Not anxiety, but awareness. Your body is trying to communicate with you every single day. Learning its language is one of the most important things you can do for yourself. And we will keep helping you do exactly that.